Huh.
Hi, I'm Dr. Roost. I'm the clinic director here at Delta Chiropractic Center, one of the team of chiropractors who will be taking care of your case as you work toward your health goals. Today you're going to be having your report of findings, which is an opportunity for you to hear all the things the doctor has found in his exam consultation, x-rays, and other tests that we took the last time you were in. This report of findings is very important because it helps you understand where your problem areas are coming from. If you came in with back pain, headaches, or neck pain, there's much more to that than just headache, back pain, or neck pain. There's underlying causes that can come from everything from nutritional imbalances to stresses in life to what we mainly focus on, which is the spine and misalignments in the spine that impact the nerves. So we're going to talk about subluxation, we're going to talk about degeneration, we're going to talk about alignment of the spine and how these things can impact the nerves that control everything going on in your health. I wanted to touch for just a moment on what can cause misalignments, or what we call subluxations. There's a couple pieces to that. It can be something obvious like a trauma. You fall or you hit your head or you have a car accident that jars things out of place. That could do it. Usually though, it's more subtle and slow than that. The alignment of the vertebrae is pulled out of place by muscle imbalances. We develop muscles that are stronger on one side than the other, and it pulls the vertebrae out of place little by little until it finally starts irritating a nerve and causing symptoms like back pain, neck pain, and etc. So muscle imbalance can happen for a number of reasons. One, if you tend to carry things on the same side all the time, like a purse or a book bag or a toolbox, you develop muscles that are stronger on one side because you're holding your body up against that gravitational pull. A posture where, for instance, if you cross your legs the same way all the time, it's an asymmetry that's pulling things out of place. Or maybe you slump to the side all the time. Or maybe when you're watching TV, you get in a comfortable position, but it's not symmetric. So ergonomic things. Speaking of which, work habits, where if you're working from a desk all the time, or on your phone all the time, or reading all the time in this posture, you're developing muscles that are out of balance. So muscle imbalance can pull the spine out of place. So misalignments can be caused by a lot of different things, and we try to undo those, first of all, by correcting the ergonomic issues. Secondly, by giving you very specific exercises that we talk about in your care plan to rebalance muscles. So the report of findings will be about a 10-minute conversation. The doctor will present the underlying causes of the issues. It will talk about the goals that we addressed. If you remember from your first visit, we talked about your goals and how they match up with our goals for you. And we summarize ours by two main things. We want you to get rid of pain, get feeling better as quickly as possible. And then secondly, we want to stabilize your spine so that you don't end up back in pain every time you twist wrong or lift something wrong or get under stress. So feeling better and building stability are the goals. We'll address those goals with a very specific care plan that will be comprehensive. It will cover an adjustment schedule, first of all, and something we call supportive care. Supportive care are things that you can do in between visits that help you get the most you can out of your adjustments when you are here. So it will include things like spinal maneuvers, very specific exercises you can do to rebuild muscle tone and balance along the spine. It will include things to be careful with or try to avoid, like twisting and looking down, and it'll include home care, like using ice or heat where that's appropriate. It will include some nutritional recommendations if that's appropriate. It will address stability in your feet and the arches of your feet so that the foundation of your spine is stable, so your spine can be built on stability. So those supportive care pieces are going to be an important part of your care plan. Keep in mind that a misalignment in the spine is not just a vertebra out of place. It's not just a pinched nerve. It's a misalignment, a biomechanical obstruction to health. Misalignments in your spine impact the motion of the vertebrae, which impacts nerves, which, depending on where those nerves come from, can impact all sorts of things in your health. Some of those nerves cause obvious things like headaches, back pain, neck pain. Others are much more subtle because some of your nerves will impact your energy level, your digestion, your heart function, your immune system. That's certainly important as we're going through colds and flus and COVID and things like that. So nerves are very important. They control everything your body does. So report of findings. It'll be interesting. It'll be comprehensive, and it'll help you get to 3 goals, which are, again, get better faster, stay better longer by building stability, and through all of that, we're wanting to keep finances under control. We don't want any financial surprises. So at the end of the care plan, we'll talk about the financial piece too, so that you know exactly what your insurance is going to cover, what your responsibilities will be, and how you can best make decisions with all of these pieces in mind. So, glad you're here. Looking forward to seeing you get better faster. There's good things ahead for you. So, God bless. Your doctor will be in just a moment.
Huh.